This set of slides showing case study. They are about more than 10 cases with history and clinical data, and according to this clinical data, the choices given to choose the correct answer among them. Case number 1. 70-year-old woman at an extended care facility for the past 2 years. She has increasing inability to perform activity, can no longer recognize her family. She is lethargic, spends most of her day in wheelchair or in bed. She developed acute febrile illness and is noted to be coughing up with productive yellow sputum. Her temperature about 38 centigrade. Chest X-ray show infiltrate which involve left lower lobe. Sputum sample showing numerous neutrophils and a gram-positive diplococci. Which of the following infectious agent is most likely to cause her pulmonary disease? To discuss this case, this is elderly woman, lethargic, about to be bedridden, develop acute febrile illness. Her febrile illness is associated with cough and yellow sputum, high fever, chest X-ray showing left lower lobe. Here we are coming to the answers of this question. Pneumocystic jirovecii, Listeria monocytogen, Cryptococcus neoformans, tuberculosis, Legionella pneumophila, Staphylococcus aureus, Streptococcus pneumonia, influenza A virus. How could we reach the correct answer? I will give you note about the keywords in this case, and according to this case you can use the keyword in other cases. Sputum sample showing numerous neutrophils mean this is a bacterial infection. It is not viral infection. Gram-positive diplococci, so it's bacterial infection. We exclude fungal infection and viral infection. Which of the following infectious agent is most likely to cause this pulmonary disease? We are looking for diplococci. Which one of these following microorganisms have this appearance on sputum sample and showing a gram-positive stain? You can choose the answer. Going to case number 2. Case number 2. 50-year-old woman lived in Oslo, Norway all her life, worked as seamstress. She's non-smoker, has had increasing shortness of breath, fever, weight loss, and night sweat for the past 4 months. On physical examination, temperature is about 37.6 centigrade. There are fine rails in auscultation in all lung fields. X-ray showing hilar lymphadenopathy with reticuloendothelial pattern of small densities in all lung fields. She demonstrates energy by skin testing to mumps and candida antigen. Transbronchial biopsy performed microscopically show numerous small pulmonary interstitial non-caseating granuloma. According to the clinical feature, the chest X-ray, let me use the pen. The clinical feature, patient increased shortness of breath, fever, weight loss. Okay, next what we are thinking of? We are thinking of certain diseases that cause this type of symptoms. So, on physical examination, what will we have? We have temperature, fever, patient, mild fever, chest X-ray, hilar lymphadenopathy. Demonstrate energy by skin test to mumps and candida antigen. Where should we see this energy or skin test to mumps and candida antigen? You can look for this test or this reaction. When could we find it? Transbronchial biopsy showing numerous small pulmonary interstitial non-caseating granuloma. According to these keywords, hilar lymphadenopathy, skin testing to mumps and candida energy, transbronchial biopsy, interstitial non-caseating granuloma. What is your diagnosis among all these choices? Case number 3. 55-year-old man, smoker man. He's a smoker because he smoked 50-pack year, history of smoking cigarette. Recently experienced episode of hemoptysis. Oh, this is serious. When there is hemoptysis and he is a smoker, so this is serious. Okay, we have to think about something serious rather than infection, actually. Anyway, on physical examination has no abnormal finding. Sputum cytology showing atypical cell. So we are here in the track of being that the tumor is, we have a tumor. Hyperchromatic nuclei, orange-pink cytoplasm. So we are dealing with which type of tumor? The description here is going to be squamous cell carcinoma, actually. Okay. Laboratory studies show serum calcium, high serum calcium, because normally the calcium in between 8 something to the 10.5. So this is high. This is considered high. A bit hypercalcemia. So the patient might have paraneoplastic syndrome. Okay. Of hypercalcemia. Which of the following chest radiograph finding is this man most likely to have? I don't want the diagnosis here. I want the most common radiographic finding or chest X-ray finding that this man most likely to have in case he have squamous cell carcinoma. Is it pneumonia-like consolidation? Is it large hilar mass, peripheral nodule, cardiac compression, or left pleural thickening? I think this question is easy. Next. Case number 4. During cardiac arrest, 58-year-old man, non-smoker, received cardiopulmonary resuscitation, resuscitative measures, and brought to hospital, intubation done for him. While he was intubating, there is aspiration of the gastric content for any reason happened to him. He aspirated, for whatever the cause. Later on, what happened? In the next 10 days, he developed non-productive cough with fever. Chest X-ray revealed 4 centimeter mass with air fluid level. Here, we are concerning with the mass lesion, mass. But this mass occurs after 10 days of intubation, of aspiration. So I don't think we are dealing with the tumor. Especially here, there is air fluid level. And sputum gram stain revealed mixed flora, that not specific. Result. Which of the following condition is he most likely to have? We are thinking here. Let me use the pen. Non-productive cough, fever, that means there's infection. And there is a mass lesion, okay. So, with air fluid level. What is the choice here that matching this description? You can choose. Next case. 58-year-old man developed non-productive cough, worsening over the past 2 months. Become worse over past 2 months. Last week he noted appearance of blood-citric sputum. So here we are going to be more concerned about the symptoms. Expiratory wheezing. Chest X-ray. We are coming to the chest X-ray. Reveal 5 centimeter mass near left lung hilum. Oh, this is bad. This is pretty bad, actually. Anyway, sputum revealed presence of small cluster of very hyperchromatic pleomorphic cell with a scanty cytoplasm. I think we are catching the tumor here. We are dealing with the tumor. Which of the following is the most likely predisposing factor to the development of his pulmonary disease? Do you know what the type? You have to know the type of the tumor to know the type of the predisposing factor that lead to the development of the disease. As I think it's easy question. Next. A vehicular accident with blood loss leading to prolonged severe hypertension. Here we have an accident with blood loss and there is trauma. Patient have hypertension, intubated, placed in mechanical ventilator. Progressively decreased oxygen saturation despite increasing PEP and oxygen content about 100%. He remains febrile, but he dies 3 days later. Oh my God. At the autopsy, what would we find? This distal lung showing pink hyaline membrane. Oh, so we are coming here with to know the diagnosis. Thickened interstitium. Here is the. So there is an accident. Loss of the blood. Severe hypertension. Patient shocked. On mechanical ventilator. Die. What is the cause of death in such a patient? Lung showing pink hyaline membrane. An autopsy or autopsy. The distal lung showing pink hyaline membrane. Thickened interstitium. Many macrophage with a few neutrophil. Which of the following pulmonary disease most likely complicated his course? Ding, 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 ding. Which one of those? It is another easy question. Case number 7. 51-year-old man complaining of slight cough for 1 week. He's non-smoker. On auscultation, chest is clear. By X-ray, we find that subpleural coin lesion. This is the keyword. This is the key of the question. In the right upper lobe. Which one of the following is most likely diagnosis for this lesion? Actually, there are certain differential diagnoses of solitary peripheral coin lesion, which include lung cancer, mostly adenocarcinoma, because adenocarcinoma most likely arise peripherally, granuloma in the tuberculosis, hamartoma, which is a benign lesion of the lung, so it appears as, and it's called also coin lesion. Among those choices, which one matching the chest radiograph subpleural coin lesion finding? Next. Case number 8. 54-year-old man which has fever and dyspnea for 1 month with 2 kg weight loss. On physical examination, her temperature is about 37.7 centigrade. X-ray showing reticulonodular pattern along with prominent hilar lymphadenopathy. Transbronchial lung biopsy performed and macroscopic examination showing no viral inclusion, no fungi, no Staph bacilli, nor atypical cell. So, which of the following disease is she most likely to have? While all these are excluded. Case number 9. 12-year-old girl has acute onset of dyspnea and wheezing. Patient has difficulty in breathing. She coughs up large thick mucus plug. She had the same experience previous episode for the past 4 years. According to her vital sign showing that's a bit tachycardia and her breathing sound is decreased in all lung fields, while chest X-ray showing hyperinflation with no infiltrate, blood work showing white blood cell count abnormal, with differential showing a bit high eosinophils. Actually, this is high, considered high. Sputum sample examined showing increased number of eosinophils. I think within the options given as a choices, you can get the diagnosis easily. Next.